telehealth, being able to access a doctor remotely via video. That has been an entire new layer that's truly increased a lot since COVID. In 2020 or pre-2020, it was a thing, it was around, but now it's becoming common, even the norm for a lot of medical appointments to access that with telehealth instead of in the office. And with telehealth, I think we moved too fast. We need to slow down and wait and say, is telehealth accessible for these patients, for people who are deaf, hard of hearing, and other marginalized groups? That Zoom and FaceTime have all of these options and have different sizes and fonts, but telehealth often doesn't. You have no option for transcription or caption. And so healthcare is a really important scenario where it could be life or death, and we have a right to equal access. And even some of the basic things like captions that are built in automatically to some of these other platforms like Zoom are completely missing. There are also other platforms that only have the ability to have two providers or two parties, the patient and the provider, and they don't allow access to a third party. And that third party could be a third screen, a third user, like an interpreter. It could also be a family member, a companion, an advocate, somebody who is stepping into that situation in one of those roles, but they might struggle because the platform simply doesn't have the technological ability to include a third party. So those barriers are there.